Hello, everybody, and welcome to Living in McKenzie County, the podcast. Today, we are actually filming, and it is Veterans Day week. So we're repping some red, white, and blue, and very thankful to our veterans this week. This episode will actually drop on November 19th, and we are so fortunate to have with us today representatives from McKenzie Health. And so we're going to spend some time talking about the current position of McKenzie Health and currently how the system serves our residents in McKenzie County and regionally. And then we're going to spend a little time walking back in time, get in the trenches with the history of our growth, and then we might look towards the future and see where we're at as we move forward. So to kick it off, we're going to go around the table, and I want each of you, representatives from McKenzie Health, to introduce yourselves. And Doc Ramage, if you can just take a pause and share with the audience your military service for us as well. So let's head this direction.
Okay. My name's Gary Ramage. I'm a medical doctor originally from Canada. I came here in August of 1995, and at that time I was in my 8th year of Reg Force in the Canadian Air Force, working at an infantry training base. And I had finished tours of Rwanda and tours of Haiti. And being back in Canada in relative peacetime, there was a bit of a lull. There was a lot of people who were above me who weren't moving on, and there really wasn't much future for me to stay in the military as a peacetime doctor. So we came to Watford City, North Dakota, which was the last great frontier.
Excellent. And I think what we'll end up doing today is probably making a few laps around the table. So we'll definitely get back to you and talk a little bit about the history, because you've been with the healthcare system for quite some time. You've seen a lot of changes. But before we get back to that, Pete, let's have you introduce yourself to the audience.
Pete Edis. I'm the CEO at McKenzie Health. I've been here for about 3 years. Came from Colorado. Originally come from farther away than that.
So just a quick question for you, Pete, before we
Sure.
keep going. You arrived January?
So I was
January?
December 28th,
Okay.
2021. And it was about 2 o'clock in the morning. And it was about 30 below zero, that neighborhood. And I opened the door, the garage door, and it creaked and cracked. Everything was frozen solid. But the house was warm inside, so that was good. But it was a little bit of a surprise. But it's gotten better since then.
Good. We'll before the hour is over, we'll spend some time talking about your summer experiences here and some of your hobbies.
And I am from the East Coast, so
Perfect.
I just didn't know if you wanted me to share that. So
No, we want to be honest about our weather here. So
originally from the Northeast, so we've had our share of winter there.
perfect. Excellent. So Tricia.
I am Tricia Sundeen, and I have been the manager of the Connie, Wold Welness Center, which is part of the McKenzie healthcare system. And I've been doing that for 16 years.
Time flies when you're having fun.
Actually, I think it's 17 back in September. But
Before we get further into our discussion, so we have quite a bit of history, years of service sitting at the table, which translates into wisdom and passionate care for the members of our community. Just a quick statistic I found, the last time the healthcare system reported out its provider numbers and its years of experience, just about 1,000 years of experience in the healthcare system right now. So that is pretty incredible when you think about people walking in for care for their families and for themselves, to know that they're walking into those years of experience and that wisdom and that knowledge. So thank you all for what you do. Any community, especially rural community, healthcare is such an important part of that community. So thank you so much. One of the things we were going to talk about, and Dr. Ramage, you shared that we moved into the new integrated medical complex in 2018. You spent quite a few years serving a very static community, a small rural farming and ranching community of about 1,400 people. Can you talk a little bit about the times you spent in our very static community, our period of growth, and where it is today, and the new medical complex as well?
Sure. Well, I interviewed for the job in September of 94 and ended up starting in August of 95. And I remember that Gene Veter sent me a video of what Watford City was all about. And at that time, I think we had a population of 1,250. And that included everybody who was living in Watford City, but there was a number of other people living in the county. And the thing that struck me the most was that there were free roaming herds of antelope, and there was deer, and everywhere at the outskirts of town, there was nothing as far as the eye could see. And it was truly the last great frontier. And we were so excited to come here. At that time, my daughter was 10 days old when we first came, and my son was born here, and we raised our children here. When we started, McKenzie Health was just an idea in the future. It was McKenzie County Hospital was the hospital aspect of healthcare, and then the clinic was owned by Med Center 1, which is Q&R Clinic, and they are the ones who actually hired me and then loaned me out to the hospital. They paid my salary, but loaned me to the hospital to provide services for Watford City. So we went along in this type of agreement for, I think, about 7 years. And then Med Center 1 decided that they were going to discontinue their rural hubs. They started a program where they created a number of different rural clinics all throughout the state. And I think there was 9 or 10 of them. But they came to us first and said that they were going to basically close. They were losing money. And so they wanted to close the clinic. And I'll remember that Tom Naring was an executive vice president, and so was Dan Thompson. And they sat on my couch in my office and said, we were good friends at the time, having worked together for a number of years. They said, we've got some good news and some bad news. And the bad news is that we have to close the clinic. We're not, the revenues don't meet expectations, and we're not able to do it. The good news is that we have a job for you in Bismarck. So at that point, I was very confused, and I didn't know. But ultimately, what we ended up doing is that I stayed in Watford City, and I kind of amalgamated with McKenzie County Hospital as their employee. So I went from being an employee of Med Center 1 to McKenzie County Hospital. And in that, we kind of ended up becoming McKenzie County Healthcare Systems. And so between myself and Doug Nordby and Larry Larson and Ron Anderson and all of the board of directors there, we put together a model where we morphed the clinic into the hospital, and we became McKenzie County Healthcare Systems. And that was in September of 2002. Then we carried on in that model, and we had a number of people come through our doors. I had a lot of people who worked with us, both doctors and mid-levels for short periods of time, but really the only constants were myself and Virginia Siner and Terry Johnson and the nursing group of Brenda Fullwider and Cheryl Faulkner and Paula Brown, and I should mention because I'm sure I'll forget some people, but that was the core of the group, and it was the people from Watford City who were the core of the group who provided the healthcare to Watford City, in the form of McKenzie County Healthcare Systems, and we had an executive director. We didn't have a CEO or a CFO or a COO or we didn't have other doctors. It was me and the nurses and we had Nancy Fevold in the lab, and we had Tanya and X-Ray Bob in X-ray. So we carried on that way for a while, and then in July of 2012. Med Center 1 in Sanford, they organized together. So there was no longer a Med Center 1 or a Q&R, it just became Sanford. And then in December of 2013, McKenzie County Healthcare Systems and Sanford actually entered into a loose agreement where we would co-partner. So McKenzie County Healthcare Systems and Sanford co-partnered in using their electronic medical records and using their specialist care and things like that. And it was a good relationship, but be very, very clear, our board of directors and our people always wanted to have an individual identity for McKenzie County Healthcare Systems in Watford City. And I think we've maintained that all the way through, and it's been carried on by Pete and his crew in a tremendous way. In 2014, in June of 2014, we did the groundbreaking for the new hospital. We decided that we're going to build a hospital, and that was a big deal with basically the city and our mayor, Brent Sanford at the time, with the county commissioners, and we approved a $55 million facility, which ended up costing us $76.3 million and took 4 years to build. But in June of 2018, we had the grand opening of McKenzie County Healthcare Systems Hospital and clinic and specialty clinics and everything that it became. And so that pretty much brings us to now. Our building's been open for 6 years now, and Pete and his crew have been running it in a fashion where we have morphed from just a small facility into what we are today, and I'll let him take a little bit from there.
And maybe even before we hop over to Pete to talk about the integrated services. So let's just say 2010, 2011, 2012, we started realizing how rapidly and how expansively our community was going to grow. We had, for sure, workforce coming here, and I think a lot of workforce wanted to bring their families too. But before we hop into the new facility and the integrated services, Tricia, can you talk a little bit about the wellness center that we had in the community, our community wellness center, and then how that transitioned into what it is today and the services that you provide for the community?
Well, it was originally started in, I believe, like 93, 94 as more of an extension of cardiac rehab. It was managed by Connie Wold for several years. When she was stepping away, she invited me to come in and manage it, and I did. At the time, though, it was pretty old and dated, and it really wasn't functioning. And I did work with Jean Veter. We kind of were trying to bring the city and the hospital together to come up with something that would function better for the community because, it was expensive to run, and again, it needed some work to make it function better. Well, we hit a couple of dead ends, and it was shortly after that in 2009 when Connie Wold was had a tragic accident, and the community, we really banded together, and we were able to raise funds, and it was kind of this really big drive, a really neat thing to be a part of to build the current facility that we have. So we went from, I think it was 4,500 square feet to 20,000. So it's a pretty neat gift.
I remember it was really one of the first public facilities that the community invested in while we were growing and expanding. There were a lot of growing pains. We didn't have enough fuel pumps. We didn't have enough grocery store square footage, checkout lines. Your ice cream would melt before you got checked out. But what we had was a shared vision of the community, that we had a lot of boomerangers coming back. We had a workforce that had a need and a desire to continue with a healthy lifestyle. And so I look to that project as one of the defining projects that lifted the community.
Well, it was almost like a test pilot. Even for the hospital, like, okay, let's try this. And is it going to work? Is it needed? And when it was built, I kind of think it made a lot of people realize that we do need to focus on a larger facility for our hospital and clinics, and it kind of gave people the, I don't know if you want to say the vision, like, yes, it's needed.
Truly a success story. So today, how many square feet do you have? What kind of programs? If people are new to the community and haven't been to the Connie Wold Wellness Center, do you do anything for them to come check it out? Do you do tours? Maybe a little bit about those who are hearing about it for the first time and want to increase a healthy lifestyle. What can you say to those folks?
Well, Connie Wold always used to say the hardest thing you'll do is walk in the door. And once you walk in the door, you realize it is a place for everybody. So we have our physical therapy department. And what's great about that is there's just so much space for our physical therapists to work with people rehabbing after surgery and injuries. We offer classes for seniors. We have a lot of equipment that works well for seniors. You're just really going to see every age and every fitness level there. And I think once you get there, you're going to see that it is welcoming and everyone has a spot there.
Very cool. Integrated medicine. Pete, I think the community had a goal for what rural healthcare could be and should be. And I think in the time you've spent here, you've definitely helped create a shared vision. Can you run with what the last 2 years have looked like for you, and maybe even where you see the future going?
Yeah, sure. Really, I think that it was underserved medically here. Certainly back in the day, it didn't. You had a lot of transient workers, from what I understand. But it's, to me, I watched the community evolve into more of a family-oriented community. There's a lot to do. The school system is good, from what I understand. The teachers are well supported. The feedback from family and the kids that go there is very positive. There was apparently at one point the traffic used to flow through the center of town, and now there's a bypass, so you don't get all the trucks running through town. It's safe. You can go out and leave your door open. Not that I'm encouraging people to do that, but we have left our door open. We don't lock our car. It is very safe. The crime rate is low. The people are genuine. They're down to earth. They're as solid as they come. Salt of the earth. Very straightforward. Very grateful for the services that we provide. I have certainly feel like I've been welcomed here. And I always say that it really has taken a team, to get where we are today. I don't think anybody really could foresee, where we were going. And we probably exceeded most of what everyone expected. And again, it's taken a team. I think hiring the first few providers was the hardest part, and then once we hired a few providers, and treated them well, word started to get out, and now we're at the point where they recruit their colleagues, which is nice. And we're getting calls from other health systems in the area of people that are not happy and want to come work for us. I don't reach out. I'm not trying to steal their staff. I wouldn't do that. Anybody that's come has come on their own volition or has been referred by a friend. And we're just grateful to have them. Grateful to have the group that we have. Staffing has been a challenge. Continues to be a challenge. But again, you can get people here with, you hire people with money, right? Money and benefits, but you keep them because of culture. So we really try to work on our culture. We've tried to really create a nice place to work, a good culture where people feel appreciated, both of our line staff and our providers. And, it all starts with them. If we don't have good staff and a good infrastructure, we don't, our abilities are going to be very limited. So I think, we've really responded to feedback from the community, from, replacing the general surgeons that we had to begin with that weren't very productive. They were very nice people, but we had outgrown, and the demand had outgrown what they were willing to give. So now we have 5 general surgeons, and they rotate. They're not, we'd love to have them come and live here, but that isn't in the cards for many of them. Part of it was we needed to establish what we could do here, because it had been, a small community hospital with limited services for many years, and not everyone realized what you could do in this environment. So bringing in an experienced general surgeon, Dr. Deering, for instance, is the first one, changed that dynamic. Dr. Deering kind of set the bar for what we could do, and it's just grown from there. So we went from transferring, many patients to transferring a handful, to other facilities, and that's a huge accomplishment. And again, it takes a team. So they did have, when I arrived, we had the general surgeons, which I've talked about. We replaced them, but we also had a urologist, 2 orthopedists, 2 hospitalists. I think that was a brilliant move on my predecessor to hire the hospitalists. They've been huge at enabling us to keep patients in-house who we would not be able to keep if we didn't have that level of medical care available.
I know you talked a little bit about, there's probably 2 parts to McKenzie Health that are notable. One is the facility itself. It is laid out well, thought out well, beautiful. And in my mind, I'm making assumptions that has helped with workforce attraction and retention, but also, and you talked about it a little bit, the culture. When we talk about how the facility itself has changed user experience, patient experience, can you share a little bit about what you've seen, probably Doc Ramage, especially going from the old facility to the new? I'm sure there's so many more things you can do, but what is the patient experience in all of that?
Okay, if we just step back a bit, is that our healthcare facility grew in lockstep with the community. As the community grew in size, we began to add things like the new high school. We added in the Rough Rider Center. We built a new golf course. And all of these services attracted more and more people to Watford City and McKenzie County. And as a result, our healthcare system did grow, and we ended up building the new facility. When we had the new facility, we really didn't know who we were going to get to come or what we were going to do with all of this tremendous amount of space. How could we ever fill up this space? Well, in fact, we've not only filled it up, but we could probably have 3 times as much space as we have and still use it. The greatest thing that we did, though, for our community was have a new set of ideas. When the old CEO and myself, we looked at it and we were both, well, we've got this built, what are we going to do? And then our board of directors decided they were going to bring in some new ideas, and Pete and a number of other people were brought in to see that vision. And that vision was, well, we need to build a big system, and we need to build our way into something really special, which is what we did. And so to answer your question about how we're serving the community, we're serving them with 50 physicians and with 20 mid-levels, that's nurse practitioners and physician's assistants. We have about 150 teledocs, which are every specialist available by telemedicine, but in turn, we've just hired nephrology, pulmonology, cardiology, interventional radiology, oncology, and the list goes on that we're bringing these people into our fold to service our community. It takes three arms, in my opinion, to actually implement this. And when you need an administration who's very proactive and says, we need this, we're going to get it. And then you need a financial arm who basically says to the administration, I can find the money for you to do that. And then you need the medical expertise of drawing on what's available and how to credential the doctors and how to make sure they're put into their situation that they have what they need to have. So we've got the medical, the administrative, and then the financial arms of how this has really come to fruition. And as Pete alluded to, our culture has changed such that if we follow our motto or our credo, is that we make sure that we meet the expectations of our patient, and that when the patient comes in, we make sure we ask them, did I ask you everything that you wanted to be asked? Is there anything more that we could do for you? Did I not cover anything? And as long as we meet their expectations, they leave and they're pretty satisfied. The second is that we create a culture of collegiality and of goodwill between our doctors and our providers and our staff. We have over 400 people employed by McKenzie Health now, which is rebranded from McKenzie County Healthcare Systems. But we create that attitude, and that becomes a self-referral base because people want to come and work for us and want to work with their friends, and everybody's nice and happy. And I think that the last thing, and probably the most important part, is that we look after our patients the way we'd like to be looked after ourselves. And to that end, I think that all of our old people, the old community members who are dating myself back 30 years, your mom and the rest of the crew, they still look at us and say, okay, I remember when it used to be what it was, but boy, is it different, and is it ever better now?
Does anybody else want to add to Doc Ramage's reflection of what probably the core culture is, what the patient experience is? And maybe I'm putting it too much on you guys. I can share a little testimonial, and it kind of walks through probably the history of the organization a bit too. And we all agree that the hospital served the community very well until the community started growing rapidly. And I remember one fall we were out riding, and I had a horse fall on me, and I was pretty sure I broke a bone in my foot. I knew something was very bad. So I got back, called McKenzie Health and said, can I come in for an x-ray? I'm pretty sure I broke a bone in my foot. And at the time, they were triaging energy, oil field related accidents, and the population, there was just such a demand on the system. And the nurse that answered the phone, she said, actually, can you maybe wait like 4, 5, 6 hours? Because we are just so backlogged. And so you look at it, and we're kind of in a situation where the healthcare system couldn't expand without a new facility, but a new facility in a challenging time and place had to be able to deploy the human resources to achieve goals and missions. So Pete, can you talk a little bit about that balancing act of how you ratchet up and grow and keep the stool level and stable?
It is no easy challenge. I mean, it's no easy task, and it's very challenging. And, fortunately, we have some good staff, and we work together as a team, to accomplish that. Recruitment doesn't begin and end with one person. Recruitment, is a team effort. Even when we recruit providers, we get our providers together, we go to dinner with that person, and they get in dialogue with them, and then they're available after the interview. And I think that is the way it is across the board, is that we try to treat people well, welcome them, provide a good environment for them, provide fair wages, and just hope that that they will stay with us, even a lot of our travelers, because as we open up new services, it's not very easy to find people that are experienced in those services. And, obstetrics is one, labor and delivery. Where are we going to get nurses that have that experience? They're not available locally. So we hired in some new nurses that are experienced and actually some new nurses, and then pair them up with a traveler who has been, who has, for whatever reason in their career, they're at a point where they want to travel, whether they want the experience or the money, or, they weren't happy where they were and they travel, but they've got some really good experience. So we brought them in, paired them up with the folks with the staff that do not have that experience. And that model has worked out real well, because we're not leaving them to hang out to dry and saying, figure it out. We're actually supporting them to the best of our ability so that they can provide the very best care that they can, the most appropriate care that they can. Did that answer your question?
Yes, it does.
And treating people well, I think, one of the things that I preach all the time is this idea of just culture. If someone isn't doing their job and they made a mistake, why did they make the mistake? Did they make the mistake because we didn't train them? Did they make the mistake because we're overworking them, right? Did they make the mistake for other reasons? What can we do to support them so it doesn't happen again? So it's not necessarily punitive. It's more, we evaluate it. Now, if the same mistake happens over and over again, then that becomes a different, or it's a critical mistake, that's a little bit different. But we really try to support our staff. What can we do to support you? Okay, you made a mistake. What can we do to make this better? And, the same with our providers. When our providers are not, let's say they're not seeing as many patients as we'd like them to see, we sit down and say, okay, what are the barriers? And we find out from them, what can we do to support you? Maybe our expectations are not with reality. And at times that happens. Or maybe our expectations are right on target, but we need to provide some more support to them. So it's just a kind of a different way of thinking. I'm sort of from that old school. I grew up and I've been, working since I was probably 10 years old in some form, working for money, and, work hard. But today's work environment is different. It's not that people don't work. It's that we've learned over the years, and we can do better, and we should do better, and we should treat people better. And if you do that, they're going to work hard for you. The majority of them are going to work hard. We lose people, I would say, not so much for the money or the culture, but more so because life took them somewhere else.
Mm-hmm.
That comment segues into a little bit of a topic I wanted to make sure we cover today, because you can do all the right things, and like you said, life sometimes takes people away from McKenzie Health or the community, the Western North Dakota. Recently, the community launched the Buccaneer Skills Center, and Health Careers, I would say, was the pilot pathway to that launch and that project. I think I don't know the statistics, but can you share the relationship that McKenzie Health has with the Buccaneer Skills Center and the CWE program especially?
Yeah, and Trish can probably speak to that as well, because she's been a champion with that, where she has brought in teens, high school kids that are old enough to work, and they work with her, they continue with her, they sometimes, take a full-time job with her, or they continue on part-time, and she's been really successful. But that model we use across our system, maybe in the nursing home, assisted living. We've had students in med-surg. We've had them in our clinic. We really try to give them that exposure and interest them in healthcare. Kids grow up, and I did it when I was growing up. Couldn't wait to grow up and move away, right? Couldn't wait to grow up and experience the world. But, maybe we just need to make it a little more attractive here for them and show them, some of them are going to some of them are going to go away. Some are going to go to the military. They're going away to school. But let's give them something to come back to. Let's interest them in what we have to offer. This is a special town. Small towns are very special. Rural communities, there's a lot to be said for a rural community, raising a child in a rural community. I raised my daughter in a rural community. And, our neighbor would look out for her. She watched out for her to get off the bus, gave her cookies and milk, and they had a really special relationship. And those are the kinds of things you see in small communities. And that's the thing that has attracted me to these communities throughout my career.
And I take a pause here. When I think about where Emily and Theo are today, and I think about where Trisha's girls are today, I had an experience several years ago, but my son was probably a fifth grader, and we had a bunch of fifth graders in the car and a bunch of sixth graders in the car. And just out of the blue, I said, "Hey, boys, let's just do the block around." We were getting new homes in Stepping Stone, and I wanted to see how those were coming along. And the boys in the back, they were just excited. They just finished up a baseball game, and they started talking about how, and it was not provoked. I can assure you it was not provoked, but how they were going to come back to Watford City and live and raise their families after they got done with school and prep work and all of that. And it was a very exciting experience because, in the 90s and the 80s and probably even the 70s, the message was not that. You need to go get your college degree, and then you need to get to a metro area. And so it all ties back around to quality rural communities with quality healthcare, quality schools. But Tricia, can you take just a little bit of time to talk about your CWE experience and maybe some of the success stories, or maybe even some of the learning opportunities that has provided you?
Well, for me, I love having a CWE because, one, I think they're fun and I think they're interesting, and I want to provide a space where kids can learn, but yet they learn to work, but yet they learn to enjoy work. And then I just provide them with the opportunity coming back on breaks and summers. I do feel like our healthcare system has a lot to offer, and so I always like to hold on to these kids as long as I can. I always tell them, I'm not going to let you quit. And they do keep coming back. In fact, I have a CWE that is currently in Fargo right now. She worked for me for years, and her goal is to go on to med school and come back to the area. We'll see if it happens. But, it's even now with, some of the CWE students that Cheryl Faulkner has had, they're working on their nursing degrees. She provides them with an opportunity to come back, get a lot more real life experience, but then they become more familiar with our facility and the culture that's been created, and hopefully then it's something that they do want to come back to.
And from the hat that I wear, the work that I do, that culture building, is just so important. If we have businesses out there listening and they maybe have a culture program they do or don't realize, having the CEO sitting here, having employees, providers, can you talk more about culture and the process that was built over a fairly short period of time? I feel like just going from a community and a place that struggled to recruit providers to, switching that narrative, shifting that gear, really finding a pace that is good and brings really quality healthcare to the community. Can you talk more about the culture?
I think the culture of our town, of our city, Watford City, and it really hasn't grown that much, from 1,250 people to maybe, the numbers anywhere between 10 and 12,000. So we really haven't grown that much, and I think the values are still there. They've always been there. They've always been open your doors, let your kids go out, let them go to school, let them walk home. When they get home and they drive mom crazy, open the door and say, go find your dad, do whatever. And I know Tricia and my wife, we've all raised our families in that same group-oriented culture within Watford City. That's very unique to our city. at the same time, our medical system has grown with that culture in mind, that we look after our own and we treat our people well. And it used to be where they had to go to either Bismarck or Minot or maybe to Billings to get their specialty care, or if they got injured, that's where they had to go. And with our changes, we're now able to provide that care locally. And that's been a big change in our community that even adds more to the culture and adds more to the togetherness that we're all experiencing, because we're all doing it together again, and we're not basically dividing it up. And I know that there's lots of businesses in town that have the same type of culture as well. They provide the same opportunities for their employees and work hard to fit into what we do in Watford City with Red Fest and and homecoming and things like that. And I know I go downtown during our festive events and I'll look down there and I'll probably know maybe 25% of the people, whereas it used to be I went down and I knew 100% of the people. And so we do see the turnover of individuals, but at the same time, I see the culture staying intricately the same, and like I said, this a feeling of being all together is very important to our city and what we do.
Mm-hmm. Yeah, I think we're a lot less transient, like when the boom started, you had a lot of people, but they were very transient. And now we've kind of got, we've gone from a boom to an economy. So we've gone from transient to same amount of people, but much more stable. So I feel like we're kind of getting that everyone's beginning to know each other again. If that makes sense.
It does. Yes. And it's an interesting observation because we really did front load that growth. And, there's we've talked to a lot of people, interviewed a lot of people talking about just that period of time that was so rapid and I would say so disruptive. And it was a great opportunity.
Traumatic.
But pretty much, yeah, PTSD. I mean, seriously, it was just really a challenging time. So culture reflecting the community.
But we've grown from generational culture, which is there's many people there with 5 generations of family that are in McKenzie County. And we've gone from generational to what I call them the old. And then we've got the old new. And that's the people like myself who've been here for 30 years, raised our children, and our children are now just coming back to North Dakota. That's the old new. And then we've got the new, and that's the new people who are becoming increasingly more of our population, who are participating in the culture and becoming part of the group as well. So our population dynamics are changing incredibly, and our community is changing to meet the needs of the new population dynamics.
The new.
Yep.
The inclusive old guard,
Yep.
old new,
And the old new. Yeah.
I like it. Without changing the lanes, too many lanes at one time, but definitely getting into this discussion because I think it's really important. Gene Veter's been mentioned several times today, and he was the longtime McKenzie County Economic Development Director. And Gene always said, there's 4 pillars to a community, and healthcare is one of those 4 pillars. So when you break it down to that core, it's one of your cornerstone pieces. There was a 2022 report, an economic impact report on McKenzie Health's contribution to our local economy, and it cited $58 million in economic impact. And there were some projections for 23 and 24. Pete, do you want to talk a little bit more about the economic impact that McKenzie Health has on our economy? And before you do that, I'll pause to say, as a community, we have some very God-given assets the formation below us, our ability to produce energy. But we also have some hurdles that are very difficult to diversify and grow an economy. We don't have railroad system in or out. You have to cross a bridge in all four directions to get out of here. So manufacturing and transport's a little difficult for us. But when we look at economic diversification, we truly look to healthcare, being a regional healthcare hub, as an opportunity for economic diversification. So can you talk a little bit more about what the economic impact study means to McKenzie Health and also to our community?
Yeah, I think it highlights the fact that healthcare is a backbone, the backbone of this community, the backbone of any community. In terms of attracting and retaining a workforce, if you can't have a baby locally, do you want to relocate your family there? If you have to travel an hour, 2 hours, 3 hours, depending on which direction you go, for healthcare, if you can't get a colonoscopy locally, is that a place that you want to relocate? The money may be good, the jobs may be prevalent, but is that a place that you really want to settle? And so having good healthcare, having accessible healthcare, I think is very, very important. And we definitely have tried to make healthcare accessible. We used to have our urgent care, which was across town. We relocated it to the main campus, integrated it with our rural health clinic. And we did it for a lot of reasons, but one of them is so that we could very easily then refer people to our primary care providers in our clinic, and hook them up with a primary care provider so that we could keep them healthy, because that's a huge piece of this. Rural communities, they don't necessarily support good health, right? They support the pull up your bootstraps, you'll be okay, go to work. Well, there's a lot more to it than that. And I think that's one aspect, one way in which we definitely contribute to the community. I think, certainly having all those folks working at our and living here. Housing, I'm surprised you didn't bring that up, has been a huge, huge challenge for us. We've actually, I never imagined that I would be a healthcare administrator and a landlord at the same time. And we have probably 70 units between apartments, houses, townhouses. And really it's necessary because if we didn't have those units, we wouldn't be able to support our providers. We have our 50 providers, but out of those 50 providers, it takes 400 people to support them at least. And we got to have housing. So that's been important. And I know we've worked together, in our circles, JDA and the economic development, and even Rotary, to talk about housing. So that's certainly something that is being addressed, albeit not quick enough. But also every one of our employees are contracted individuals. They're going to the store, they're making purchases. They are in one way, shape, or form, they're spending money and investing in this community, and that helps the community grow.
And so let's talk about something real quick here. There's the acronym STP, same 10 people that show up for everything. And Pete, you're on that list. You serve on the McKenzie County JDA Authority.
Right.
You serve on the Watford City Economic Development Corporation Board. And you're a Rotarian. You probably do other things that aren't within my circle of daily business, but
probably just about anything you ask me, I will do probably. And it's been good though, because it's also expanded my resources. In order to be a good CEO, I have to have resources. I need to know who to call and who's good at what. And I, because of my involvement in those community activities, I know who to call. And I would be remiss if I didn't say that, I could pick up the phone and call just about anybody in this community, and they would do their best to help me. And I'm not unique in that.
In this community, that's definitely what this community does, I guess, is
Right.
identify a problem and take it down for the success and betterment of the greater good. But getting back to that, you always report out every month at those meetings what I call key performance indexes. And one of them that you always you give us two. One, you don't think it's funny when I say it, but you always report on the number of babies year to date.
Correct.
And Tricia, I think that Pete should do little ear tags and number them 2024, number 1, number 2, number 3, number 4. And he does not think that is funny.
I don't think the parents would be too happy. And the babies would grow up and they need therapy for the trauma we caused them.
I mean,
Right.
it could, anyway. But one of the things you always report on is transfers out. And, I listen and we see those numbers go down and down and down. And every time, this is maybe insensitive because we should be patient first. And I'm sure those transfers are always patient first. But I look at those every time there's not a transfer out. That is actually an economic driver to our community because we're not sending people out to the metro areas for additional service. We're keeping them here. And so not only are there recovery benefits, patient first, close to home recovery, but there's that all, supports these economic impacts to the community. The less we're transferring out, the more people that McKenzie Health is employing, the more providers, because you're handling more of the services holistically and in-house. So can you talk a little bit about your key performance indexes that you report out, your transfers, your babies born, the things that are happening in terms
the
of
transfers
service?
are huge because really it's a benefit to the community like you spoke of, but also it's a benefit to the individual and to the family because now they don't have to travel 3 hours. They don't have to get a hotel, right? And so, to support their loved one who's in the hospital. And let me be clear, there are certain people that need to be transferred. We don't do brain surgery. We don't do spines. We don't do hearts necessarily. We do a little bit of heart with our cardiology, but if someone needs something a little more complicated, that's going to get done in one of the bigger facilities. We can't be everything to everybody. It's not safe for us to be everything to everybody. But the more we can do here, the better it is for the community, the less they have to travel. And it's just across the board. Their recovery is better. There's studies that show that. The farther away that you have to travel for medical care, it impacts your outcome. They've looked at that with obstetrics. The farther away they have to go to have a baby, it increases mortality. So it is the more we can do at home, the better. So key performance indicators would be, yes, we keep our transfers low. If we do see some patterns where we see some that we question, then we work as a team and we investigate. Why did we transfer them? Was there something we could have done differently? Did they not know we had a specialist? So, we look at that very closely. And just to really, it's multifaceted. One, of course, economically, but again, the convenience to the patient, right? If we can do it here, why would we, unless the patient really wanted to be transferred, why would we transfer them? So it's inconvenient for them. Number two is we always look at our volumes. So our walk-in clinic has about 5,000 patients a year. So you're quite a large volume there. Our emergency department, about 5,000 visits a year. Our rural health and specialty clinics, again, 5, 6, 7,000 a year. They're very busy. Our parking lots, when you drive by now, are full. If you come by on a Monday, Tuesday, and Wednesday, out front, you're hard pressed to get a parking spot. So we've addressed some of that, and hopefully it will. We're doing the best we can with what we have to work with. We have, like Dr. Ramage mentioned earlier, we never imagined that we'd outgrow the facility we have, but we have. So parking is an issue. We're aware of it. We are trying to address it. But so that's something else we look at too. Let's see. What am I missing, Dr. Ramage, as far as key indicators? We look at our length of stay, for our patients. We look at our utilization of our swing bed. We have this great thing for swing bed that is, open to Medicare patients. People, they wait their whole lives to get on Medicare, and they have this opportunity to have extended rehab in a swing bed because of the type of hospital we are, critical access hospital, we're able to offer that. So we look at those numbers as well. We look at, our nursing home utilization. Do we have open beds? We have the capacity to go to 48. We're currently at 36. We took 12 beds and put them on hold. And as soon as we put beds on hold, then we have a waiting list. It's kind of the way it works, right? Our assisted living, we have 15 apartments. They're full, and they don't turn over very, very much. When they do, we are trying to keep them upgraded. We're doing some work on them so that they're nice for the next person. But there's lots of little metrics that you look at.
I am committed to keeping my testimonials to less than 3. So I've shared one, which was the early days when we needed 10 ER bays in the community, and we had one. Something that happened just a couple years ago, it was icy. I was walking. I slipped on the ice, and I broke my ankle. And I think back to that experience, and within a couple of days, the best man in our wedding, they live in central North Dakota, so they're just south of the Peace Garden, very rural. He did the exact same thing. We compared x-rays, and it was almost identical. But he had to travel 3 hours one way for each appointment to Grand Forks. Dr. Joshi did my pre-op, telemed, prepped it, and came in very time sensitive, fixed it up, and I never had to leave Watford City. And so our best man and myself, we've kind of kept notes, and my recovery was faster. I think back to how painful that must have been for him to be traveling back and forth and, just all that goes with that trauma. So that opportunity wouldn't have existed 6 years ago, 7 years ago, 8 years ago here. And I just think of to be able to live in a town our size, we're less than 10,000. Actually, our wastewater treatment plant, to your point, Dr. Ramage is telling us we're treating about 8,000 people a day. So we're around 8,000 people. Census thinks we're less, but we're around 8,000. But to have the treatment, the providers that we do, it's truly a blessing to our community.
I would be remiss if I did not share something with you. We had the North Dakota School of Medicine here recently, and they were just amazed at what we were doing. And they were just, the feedback was really positive. Matter of fact, they were like, we're ready to move forward. How can we send, more students your way? And so we're going to get them. It's going to be a process, and maybe even develop as a residency site someday. But they were just so thrilled with what we were doing here. They don't see that across the state of North Dakota, not in the rural areas anyway.
Yeah, I had the opportunity to spend 2 hours with them, and that's exciting.
You did?
Yes, that was a pleasure and a treat. That was very exciting.
Oh yeah, you did. You took them on the tour in the community. Thank you for that.
Yes, we had a great time.
Yep, they really enjoyed that. And I'd like to say that's when you talk about how do we retain employees, that's a way in which we retain the employees. We have them, all of our employees go on that community tour. It's a very similar tour. And so all of our new employees, we send them on that tour. We've had the tourism come in and work with our HR staff, and then so that our HR staff are familiar with all the great things that are going on here, and they can talk to our new employees about it. I also meet with our new employees. I meet with all of our new employees during orientation, and then I meet with them again at 30 days to see how we're doing, see how they're doing, see what kind of feedback they have. And I do get some feedback. It's good. It's been real good.
Success is self-sustaining, and you've described what happens when people come and they're taken care of well. We meet their expectations, and they're treated as if we're treating ourselves. So we end up with people who are very satisfied with what we're doing. And to that end, we've become a rural center for excellence. And I truly mean this, that with the different specialties that we've recruited and the fact that people can do their medicine now at home, they don't have to travel, and that we have virtually every specialty across the spectrum available here to be done, it makes for a self-sustaining group of people who are really working well together, and our community benefits from that, and our community feeds off that. So if you follow my logic here, I mean that we're self-sustaining because we're successful.
And you're successful because you're self-sustaining.
Well, because we built a rural center for excellence.
And I don't take any of that for granted. I think what we have is really special, and it's a testament to the hard work of everyone that walks through that door every day. And they we're just very fortunate to have the team that we have and the folks that we have working with us. And those that, there are a few that maybe it isn't right for them, and that's okay. They find other places to go. But by and large, I would say the people that walk through that door are mostly happy.
And we are getting really kind of down to just a couple more discussion points. But I think you kind of walked into one of them, Pete. So when people think about healthcare, and I married into a family of medical providers and veterinarians. And so both my brother-in-law and my father-in-law is retired now, but both family practice providers. And they both talk about how the medical industry has changed over time. It's kind of become, a quota-driven, reimbursement, difficult situation. But can you talk a little bit about how McKenzie Health differentiates from your, I would call it, typical big box medical experience? Can you kind of talk a little bit about that
I think it's
difference?
personalized care. Both of my parents were in the hospital at the same time last summer. So my wife and I ended up going back east, and because dealing with them on the phone was, the medical providers and so forth was terrible. And I don't want anyone to ever experience that in a facility that I am associated with. And it's not that they didn't get good care. It's just that communication was terrible. And I think that is huge. Communicating, returning phone calls. I tell our staff in orientation all the time, our new staff, people don't wake up and think it's a lovely day. I'll go to the hospital. They don't think, it's a lovely day. I think I'll go to the emergency room. They go when they have no choice, most of them, when they have a problem. And they bring baggage with them. They've had experiences at other facilities, and some of them haven't, and maybe our facility at some point, it wasn't a good experience for them. And so we just have to remember that, they bring those experiences with them. They may be tainted, and our job is to make it as the best experience that we can. And, if you treat people well and you make a small mistake here and there, they're going to forgive you. If you don't treat them well and you make the tiniest mistake, they're not going to forget it, right? And especially in small communities, word gets around, and we want that word to be positive. We see our patients in the grocery store. We see them in, meetings. We see them at Rotary. And I had a gentleman in Rotary that walked up to me this past week, and he said, Dr. Deering, one of our general surgeons, he said, he is just the best. And he was talking about his colonoscopy and what a great experience it was for his colonoscopy, and how the staff treated him well. And he used to go to Bismarck, and now, he's so happy to be able to come here and get those things done. And then he proceeded to tell me about a year ago, Dr. Deering took a cancerous lesion off his head. And he says, I'm just so happy to be able to do that close to home. Those are the things that drive me. They make me feel good. Those are the things that we want for our community.
Excellent. So kind of the last thing on the list that I wanted to not miss is an opportunity to just share gratitude out. And I think we are a very, very unique community. We have a strong economy. We have been gifted with resources that many other communities don't have. Having said that, those gifts are usually nurtured wisely in our community. And so we have a very giving community, both corporate givers and personal supporters of McKenzie Health. So is there anything you want to share out during this time that those opportunities have provided for the experiences of people seeking treatment at McKenzie Health?
And I don't want to hog the mic, so I'll defer to Dr. Ramage and Trish, and then I'll fill in any gaps. How's that?
That sounds great. You'll be the sand in the marbles.
Well, I was firsthand in seeing how giving the people of our county can be, but also the new companies coming in because of, our drive with the Connie Wold Wellness Center. It's actually very humbling. And sometimes, when I think about it and I'm in our facility, to me, I'm always like, okay, I have to respect this. This is a gift. And, for me, it just means a lot. It means a lot to be a part of that process, but also to, see what collectively people can do. And I know firsthand that, our benefit foundation, it's been huge for what we can provide.
Agree.
Yep. I've been grateful for this community from the time we arrived here, and I've been grateful for the trust that has been placed in me, and at the same time, it makes you want to work hard to earn that trust, and give back as best you can. And to that end, we've now got an administrative, a financial, and a medical group of people who are all working to keep the trust of our community and to have people come and enjoy, all of the aspects of sometimes situations that are very traumatic for them and are very painful for them and their families, and involve grief and loss and the spectrum of everything negative that's associated with bad health. But at the same time, we continue to work to earn their trust, and that to me is the most rewarding thing about being in McKenzie County and Watford City.
I would concur. Absolutely. I don't think I've ever been in a community that is so generous. And certainly there are expectations. It's not just given blindly. There are certainly expectations there. They want to know that the donation went for a specific cause and was spent appropriately. Our development officer, Lynn, does a fantastic job out in the community. She's developed these relationships and has earned the trust and has from the donors. And we've been very fortunate. We've been able to do things like, expand our chapel, install a year-round greenhouse that our residents will have access to with heated sidewalks so that, they won't slip and fall in the snow, and we can actually use it year-round. These are just recent projects. The assisted living, the expanded kitchen, it's beautiful. And they really enjoy that and have made great use of it. It's really improved their quality of life there. And then there's just, that's just a few examples. We have had radiology equipment funded. I've lost track of how many things we've purchased with donations. My first week here, I was got a call down to the front of the hospital, and there was this older lady who I'd never met before. And she said, I've been blessed with this money. I just want to donate it to the hospital. And she didn't want any recognition. She didn't want anybody to know. She said, it was $50,000. And she wanted me to just take the $50,000 and, just take it and deposit it in the hospital's account. And that's, that was, it was a sign of what it would be like. I wouldn't say that they just walk in the door, but we have a very generous community. And that is part of what brought me here and keeps me here. And like Dr. Ramage, I feel very privileged to have that trust, and to be able to provide services. And I say I do very little. I don't provide services. I'm an administrator. Dr. Ramage provides services. Our staff provides services. And to be able to witness that and see the gratitude from our community is huge. I've been a recipient. My wife had her hip replaced last December. I never missed a day of work. I missed a couple of hours, but I was able to walk down the hallway. She was happy. She's not easy to make happy. And she was happy.
Hopefully Donna's not watching.
Yeah, I was going to say, ugh.
She knows I love her and I tease her. So, but she was, they were taking good care of her. She felt that she was in good hands. She had her hip replaced. She was out of pain. That was huge. And we did that right here, right close to home. I didn't miss a day of work, versus had we not had those services available, she would have had to travel. We probably would have gone to Bismarck or Minot, and I would have had to take time off and stay overnight. And then the traveling, which is never good when you have a procedure like that. So I'm very, very grateful for what we have here and feel very honored to have that trust.
So I think I think Dr. Ramage, you referred to it, Pete, you possibly did too. It's always been a priority and probably a non-negotiable of both the corporation board and the benefit fund board to maintain local control. So the decisions being made on community health care are being made locally. Do you want to recognize any of the work? I mean, I could point out a couple people that I think back that made things happen when it would have been really easy to let independence slip away. Do you want to talk about any of those folks that positioned the organization to be where it is today?
And for me, I walked into it. This is what I walked into. So maybe Dr. Ramage or Trish can speak a little bit more to that. But I can tell you there's, our board is solid. The 9 community board members that we have are solid. Gary Brown, Randy Qualley, Justin Vole, Virginia Sinar, Jan Dodge, Monty, I always screw up his last name. Bolzomi, Chase Wisness. Solid. Yolanda has brought the Hispanic, piece. She's a great person, Yolanda Rojas, but she's also said, hey, we need to be more Hispanic friendly. And if you notice, we've put some verbiage on our doors and we've translated a lot of our literature. We're hiring more Hispanic folks now. So I think we are making progress because of Yolanda. We just have a real solid board of directors that do want that local control. So I'm, again, very grateful for that. It's another one of the reasons that I'm here and stay here. It's because of that local control. Mm-hmm. When we make a decision, we can do so with very little bureaucracy. If we get feedback from the community or one of our staff or one of our providers, we sit down around a table, we talk about it. If it involves a big spend, then we get our board involved, but because they have to approve anything over a certain dollar figure. But, we have the ability to make decisions and move very quickly on that. That makes us unique and it also adds to the satisfaction of our providers and staff who perhaps in the past maybe didn't have that, that experience. And, the larger the facility, the more bureaucracy that you have. And I won't say we have no bureaucracy, but we have very little and very little politics.
That's very important. No politics.
You made some notes there, Doctor.
I was just thinking, we stand on the shoulders of a lot of really integral people who built the healthcare system and maintained it and nurtured it as we go along. And I'll go back to Gene Veter with economic development when I first arrived and his part in making sure that doctors were recruited for the hospital. But prior to me, there was Dr. Ebel, who was here for 23 years, and he taught people what it's like to be a small town doctor in a small town community and to be able to do everything. And I took that to heart, and I think that's what I tried to be while I was here. Certainly our board of directors at each step has been very, very important in making the decision. We used to have executive directors who were managing the hospitals, which eventually became CEOs, and our executive directors were super, super important. All of our staff at the time, the nurses and the ancillary staff, the rad techs, the X-ray lab techs, and everyone was so important in doing this. And I made a list of all of the people, which I don't want to go through today, but it was wow. Like going down memory lane of the people who I've worked with in my near 30 years here. And it's a who's who of all of the doctors that have been practicing in the state for many, many years. And I looked at that, but as we got bigger and more involved, I think the way we morphed into our administration with our current board of directors and our current administration with Pete, and we'd be remiss if we didn't talk about our chief cat herder, our COO, who basically runs around from the time he gets there in the morning, basically doing what Pete needs him to do and what I need him to do.
He's young and thin, it's...
And he literally knows, I'm sure, every individual within the healthcare system.
That's true.
His name's Theo Stoller, and he does a lot of work there too. But our administrative, our financial people, even though one of them is very long-winded and takes a long time to tell us what he wants to say, and he could be shorter, he does a great. That's our
job.
CFO,
yeah.
Scott Merkel,
and
I think the people that we have right now, we've created a group of people that truly get along and enjoy each other's company and respect what each other does.
That's excellent.
I have a story for you.
I can't wait.
So when I first arrived, shortly after I was here, and this is, the Stengems have been very supportive. And Gretchen, certainly got to know her first, and she took me to a groundbreaking up in Williston, and I was sneezing a little bit, and I thought I had allergies. Well, it turned out I had COVID. And all I could think when I came back and found out I had COVID is I gave Gretchen COVID. So I checked on her every day. She never did get it, fortunately, but I sweated that a little bit. Mm-hmm. I don't think, in retrospect, knowing her or knowing them, that they would have blamed me, but I didn't know at the time. But they have been very supportive, very, very supportive of us. We couldn't ask for more support. And really from everyone in the community, but certainly from the Stengems as well. Mm. But all I kept thinking was, I got this new CEO job, and now I gave a prominent person in our community COVID. They're going to run me out of town, but that's not the truth at all. Mm-hmm. Couldn't be farther from the truth, probably. But at the time, I didn't know. So.
You didn't know what you didn't know yet.
I didn't know what I didn't know yet.
Yes.
And I would be remiss if I didn't say how much support you provide. You've been huge with us. I have my two go-to people besides Theo, besides Dr. Ramage for you and Lynn, I would say. You guys have just been awesome.
Well, and I think both the city and the county understand
And I have a whole team. Let me just say that. I have a whole team that I can go to. But outside of that team, there's a couple of key people, and you're one of them.
Well, and we always, when I look at the clientele that I serve, and our office serves our Long X development team, Daniel on the county side, myself, we always look to that list of top 25 employers. And I would be remiss if we didn't plug in the fact that McKenzie Health is always in one of the top 3 leaderboards there and continually rotating in the 1, 2, 3 spot with McKenzie County School District number 1 and One Oak. So we have a nice profile of our top employers. You are one of our largest employers. And I would be remiss too if I didn't say we get lots of support through the oil industry as well. And certainly One Oak is among them, as is Northern Fishing Tools, ConocoPhillips, and the list goes on.
And to that, I'll add the county commissioners.
The county commissioners.
And I will add the Watford City Council.
And the City Council, yes, which
been
Benita is a
very
part of.
Yeah, very instrumental in us even, getting our original facility built.
Yeah, no, it took a village to get that done. It took boots and bling, and it took 5K runs, and it took.
You did ask me about the future.
Yes.
Before and I want to make sure that I touch on that. And we've outgrown our facilities. We're spreading out into the community. And my vision is someday we'd be able to bring that together under one roof. Mm-hmm. And perhaps not. I think the hospital is adequate where it is. I don't think there's a problem there. We have outgrown it. But I think we need to look at those services that could be provided off-site under one roof.
So you have your core campus, but having a secondary campus in
Correct.
town that's consolidated
Correct.
for efficiency's sake.
Yep.
Yeah. I like that. I like to have bullet points to be working towards.
And I
for
think
future
our
planning.
oncology is, as that develops, that's going to be huge also. I think we're going to see patients come from
A cancer center with a dialysis center, and to that, we could.
Are you ready to talk any more about those future services, or do you want to wait for another day to do that?
Well, certainly we touched on them. We are in the process of developing cancer care. We recruited a cancer doctor. We have a lead nurse that Lisa Iverson, who's taken the reins with both cancer care and dialysis. Cancer care will come first, and then dialysis will follow shortly thereafter.
Cancer pharmacists, which are extremely hard to
Hard to
find,
find.
and absolutely necessary,
We have a excellent pharmacists with lots of experience in the cancer world, and we've just recruited another pharmacist. And again, I am not going out soliciting these folks from other facilities, but they've applied on their own volition, or they've been referred by a friend. So, and I'm grateful to have them. And we're lucky that culture, I think, has helped reel them in. So it is developing nicely, and look forward to seeing what we can do with cancer care for this community, and then dialysis.
Excellent. So, Brock sits behind the camera, off camera. Brock, do you want to just say hi to the people real quick?
Hi, everybody.
Hey,
Hi,
thanks,
Brock.
So Brock and I have had the opportunity to come into McKenzie Health. We're working on a project outside of the healthcare system, but working on workforce attraction, find your future in Watford City, in healthcare and education. And we've had the opportunity to interview several of your staff members. One of them, one of the hospitalists you referred to earlier, Dr. Mastrapa. And her interview was one that you could connect with, because you could see in her interview that she has found the meaning of work in this community and the passionate care she provides, because and of course you're all under HIPAA, I'm not, but she talks about how when she sees her patients in the community, how grateful they are for her service and their ability to be close to home, to receive quality care. And so under this gratitude piece, I get to partake in our monthly community orientation. And again, the healthcare system is one of our large employers. And so you always have participants in our community orientation. And when we drive by, it's their place of work. But for us, it's really a pillar of pride for our community, that integrated rural healthcare complex. And so I always take the time to thank them for the work they do, because without them, our community would be reliant on, transports out, distance and time between where treatment is occurring and where we live. So I want to make sure you all understand how grateful we are for McKenzie Health and the work that you do and the quality care that you provide the community. My last personal testimony, I think everybody around this table knows Olga Hovit, my grandmother, who is 105 years old. And so she lived independently. And when it got to the point where she could no longer, she went into the horizon for a period of time. And now she has been at the Good Shepherd home, and she thrives there. She's so well taken care of. And so what McKenzie Health means to our family and the care that she receives there and many of our other family members, I just want to thank you all so much for that. It's a blessing. Not all communities have the asset that we do, and not all families are impacted in such a positive way with their local health care. So I just want to thank you guys so much. We, the community, appreciates it. I personally appreciate it. Is there any last things that you want to share with our listeners?
I want to thank Dr. Ramage and Trish for,
Yes.
being willing to do this. And, the community, we're just very grateful for the support we get from the community. And we just will continue to do our best to serve them.
No, this is going to drop on November 19th. Do you want the listeners to know when your annual meeting is, how they can participate in the community survey? Is there any of that you want people to know, or where they can go to find that information?
Yes. The community survey is being disseminated on our webpage, and then also in some of the groups on the local groups on Facebook. So if you go to our website, www.mckenziehealth.com or www.mckenziehsnd.org. So either one of those, you can connect with our survey for our annual meeting. The annual meeting will be at 12 o'clock at the
Civic Center,
right
December the
here.
10th.
December 10th. Yep.
December the 10th,
Yep.
noon.
December 10th, noon.
Civic Center.
Civic Center.
Food.
Free food.
There will
Free
be
food.
There will be good food. Good food and good people.
Excellent. Anything else? Anything else? Tricia, any challenges to the community to sign up for a 5K?
Well, we do have the turkey trot coming up. I believe I quit counting, but I think we're around 15 or 16. So been doing it for 15 or 16 years approximately.
Okay,
That's on
consecutive years.
Thanksgiving.
It's on Thanksgiving morning. It's just, it is untimed fun. We do some door prizes. It's just, unfortunately, you only earn one piece of pie.
That's okay. Well, that helps.
Yep.
And
but
so where and when do people show up if they want to participate in the turkey trot?
I would show up about 8:30 that morning.
At Connie Wold?
Yep.
Excellent.
Yep.
All right. So Thanksgiving Day, turkey trot, 8:30, Connie Wold. December 10th, the annual meeting at the Civic Center.
At noon.
At noon, free food, good free food,
Good free food and good people.
and good people, good company, and excellent information as well.
Good information.
The annual report. So for everybody who tuned in to, it's our second episode living in McKenzie County, McKenzie Health. I want to thank you guys for being here. We called the first group Dr. Heckerman with the Buccaneer Skills Center and Mr. Green, the principal from Watford City High School. We called them victims, but can you shout out to the world in case we ping on somebody watching? Was it painful today?
You made it tolerable.
Okay, good. Well, in closing, McKenzie Health, thank you for all you do. We appreciate you
We
guys.
appreciate
Thank
you.
you.
Okay.
Thank you.
All right.